There is a specialist shortage worldwide. We had to innovate a new model. Project ECHO allows specialists like me to force multiply expertise. I think that's why it works, because it's very simple. And that's actually why I could come up with an idea like this, because it was simple. In 2003, there were 30,000 patients with hepatitis C in New Mexico. I didn't have enough time to see everybody. And that led to a lot of soul searching. What is the way that I can have a bigger impact than the patients whom I just see in my own clinic?
Well, the 1025 was 10.
It just came as an idea. Skype was available. I talked to my daughters on it. Seeing this technological revolution unfold was probably a background knowledge that I needed to come up with this idea. In 2010 alone, we have trained more than 1,000 healthcare clinicians on our video conferencing platforms. Nurses, primary care doctors, physician assistants. Uniformly, every single ECHO project that we've started, the specialists find it extraordinarily rewarding sharing their expertise to improve the health of underserved populations in the United States and ultimately all over the world.
So that's Dr. Sanjeet. He's a gastroenterologist that started the first ECHO project. And now there's multiple different ECHO projects in the world.
Project ECHO is a performance optimizer. Think of it as a high-speed internet connection for the healthcare system. It spreads new medical knowledge throughout the healthcare system, from university medical centres and other specialty care sites to the front lines of community care. Rather than information flowing in one direction, community providers learn from specialists. They learn from each other, and specialists learn from community providers as new best practices emerge. Under ECHO, community providers use video technology to participate in guided practice with specialist mentors. They acquire new skills that allow them to treat patients they otherwise would have referred out. Patients with complex chronic conditions get high-quality care where they live from providers they know. No waiting months to see a specialist. No long drives back and forth to get critical care. ECHO exponentially increases access to specialty care by moving knowledge instead of moving patients. Suffering and pain are reduced, and lives are improved and even saved. Project ECHO, changing the world fast. Join us at echo.unm.edu.
Are you part of the ECHO?
So that's a brief introduction to Project ECHO. So we start our Geriatric Project ECHO in July, and we do it every 2 weeks, every other weeks. And the format of ECHO is there's a participant, what we call spoke, that will present a case, and then the case was discussed among all the participants, and then we will have recommendations from the hub, which is our palliative team here, and then so that's part of the curriculums, and then we have a didactic, and so far it has been working out well.